If you don't stay hydrated, you can experience various negative effects on our health and well-being. 6. Skin problems and premature aging. Dehydration can cause skin problems and premature aging in several ways. Here are some of the possible explanations. Dehydration can reduce the production and function of the natural moisturizing factor, NMF, which is a group of substances that help the skin retain water and maintain its barrier function. The NMF is found in the outermost layer of the skin, called the stratum corneum, which protects the skin from external aggressions and water loss. When the NMF is compromised, the skin becomes dry, flaky, rough, and irritated. Dehydration can also affect the elasticity and firmness of the skin, which depend on the presence of water and collagen in the dermis, the layer of skin below the epidermis. Collagen is a protein that provides structure and strength to the skin, while water helps the skin stay plump and smooth. When the skin is dehydrated, it loses water and collagen, resulting in sagging, wrinkling, and dullness. Dehydration can also impair the skin's ability to heal and regenerate, which can lead to more damage and aging. The skin has a natural process of cell turnover, which involves shedding old and dead cells and replacing them with new and healthy ones. This process helps the skin maintain its appearance and function, as well as repair any injuries or infections. However, when the skin is dehydrated, the cell turnover rate slows down, making the skin more prone to inflammation, infection, and scarring. Dehydration can also alter the balance of the skin's microbiome, which is the community of microorganisms that live on and in the skin. The skin's microbiome plays a vital role in maintaining the skin's health and immunity, as well as influencing the skin's appearance and mood. Dehydration can change the composition and diversity of the skin's microbiome, making it less diverse and more imbalanced. This can affect the skin's pH, immunity, and barrier function, as well as increase the risk of skin diseases and disorders. 5. Kidney damage and urinary tract infections. Dehydration can cause kidney damage and urinary tract infections by affecting the kidney's function and increasing the risk of infection. Here is a detailed explanation. The kidneys are organs that filter the blood and produce urine. They help remove wastes and toxins from the body and regulate the fluid and electrolyte balance. Water is essential for the kidneys to perform these tasks. When the body is dehydrated, the blood volume and pressure decrease, and the blood becomes more concentrated. This makes it harder for the kidneys to filter the blood and produce enough urine. Dehydration can also cause a buildup of wastes and acids in the body, and it can clog the kidneys with muscle proteins, myoglobin. Myoglobin is a protein that is released when the muscles are damaged, such as during intense exercise or injury. When the kidneys are dehydrated, they have less water to dilute the myoglobin, and it can damage the kidney cells and block the tubules. This can lead to acute kidney injury, which can be life-threatening if not treated properly. Dehydration can also contribute to the formation of kidney stones and urinary tract infections, both of which can lead to kidney damage if not treated quickly. Kidney stones are hard deposits of minerals and salts that form in the kidneys or the urinary tract. They can cause severe pain, bleeding, and obstruction of urine flow. Dehydration can increase the risk of kidney stones by reducing the urine volume and making the urine more acidic and concentrated. This can cause the minerals and salts to crystallize and stick together. Urinary tract infections are infections of the bladder, ureters, or urethra, which are the parts of the urinary system that carry urine out of the body. They can cause symptoms such as burning, pain, frequency, and urgency of urination, and sometimes fever and blood in the urine. Dehydration can increase the risk of urinary tract infections by reducing the urine volume and frequency and allowing bacteria to grow and multiply in the urinary tract. 4. Digestive problems and constipation. Dehydration can cause or worsen digestive problems and constipation in several ways. Here are some of the possible mechanisms. Dehydration can reduce the production of saliva, which is essential for digestion and swallowing. Saliva contains enzymes that break down food and lubricate the mouth and throat. Without enough saliva, food can become dry and difficult to swallow. Dehydration can also affect the stomach and intestines, which are responsible for digesting and absorbing nutrients from food. Dehydration can reduce the secretion of gastric acid, bile, and pancreatic juice, which are all needed for proper digestion. Dehydration can also impair the movement of food through the digestive tract, leading to slow transit time and constipation. Dehydration can cause the colon to absorb more water from the stool, making it hard, dry, and difficult to pass. This can result in constipation, which can cause pain, bloating, and discomfort. Constipation can also increase the risk of developing hemorrhoids, anal fissures, and diverticulitis. Dehydration can also affect the balance of electrolytes and bacteria in the gut, which are important for maintaining a healthy digestive system. Dehydration can cause low levels of sodium, potassium, and chloride, which are needed for nerve and muscle function, fluid balance, and acid-base balance. Dehydration can also alter the composition and activity of the gut microbiota, which can affect the immune system, metabolism, and mood. To prevent dehydration and its effects on digestion and constipation, it is important to drink enough fluids every day, especially water. The amount of fluid needed may vary depending on age, activity level, climate, and health conditions. A general recommendation is to drink at least 8 cups of water a day, but some people may need more or less. It is also advisable to avoid or limit alcohol, caffeine, and sugary drinks, which can dehydrate the body and worsen digestive problems. In addition, eating a balanced diet rich in fiber, fruits, and vegetables can help promote regular bowel movements and prevent constipation. 3. Headaches and cognitive impairment. Dehydration can cause headaches and cognitive impairment by affecting the brain's structure, function, and blood flow. Here is a detailed explanation. The brain is made up of about 75% water, which helps maintain its shape, fluid balance, and electrical activity. When the body is dehydrated, the brain can shrink or contract due to fluid loss. This can cause the brain to pull away from the skull, putting pressure on the nerves and causing pain. This is possibly how dehydration causes headaches. The brain also needs a constant supply of oxygen and glucose to function properly. These are delivered by the blood, which is mostly water. When the body is dehydrated, the blood volume and pressure decrease, and the blood vessels constrict. This reduces the blood flow and oxygen delivery to the brain. This can impair the brain's function and communication, affecting the mood, memory, concentration, and alertness. This is possibly how dehydration causes cognitive impairment. Dehydration can also affect the production and transmission of neurotransmitters, such as dopamine and serotonin, which are involved in the regulation of emotions, motivation, and balance. Dehydration can alter the levels and activity of these chemicals, which can affect the mood and cognition. 2. Dizziness and fainting. Dizziness and fainting are some of the possible consequences of dehydration. They occur because water is essential for our blood circulation and brain function. When you are dehydrated, our blood pressure and blood volume decrease, and our blood vessels constrict. This can reduce the blood flow and oxygen delivery to our brain, causing you to feel dizzy or faint. Here is a detailed explanation of how dehydration causes dizziness and fainting. Our blood carries oxygen and nutrients to our brain and other organs, and removes carbon dioxide and other waste products from our body. Water is the main component of our blood, making up about 55% of its volume. When you are dehydrated, you lose more water than you replenish, and our blood volume decreases. This means that our heart has to pump harder and faster to maintain adequate blood pressure and blood flow. Our blood vessels are also affected by dehydration. They have sensors that detect changes in blood pressure and blood volume, and respond by either dilating or constricting. When you are dehydrated, our blood vessels tend to constrict, especially near our skin, to prevent further water loss and to keep the blood in our core. This reduces the diameter of our blood vessels and makes it harder for the blood to flow through them. Our brain is the control center of our body. It needs a constant supply of oxygen and glucose to function properly. Water is also important for maintaining the fluid balance and the electrical activity in our brain. When you are dehydrated, our brain tissue shrinks and our blood vessels constrict. This reduces the blood flow and oxygen delivery to our brain. It also affects the production and transmission of neurotransmitters, such as dopamine and serotonin, which are involved in our mood, alertness, and balance. All these factors contribute to the feeling of dizziness or vertigo when you are dehydrated. You may experience symptoms such as lightheadedness, unsteadiness, spinning, or fainting. These symptoms can impair our physical and mental performance and affect our quality of life. In severe cases of dehydration, fainting may occur due to a sudden drop in blood pressure, which can cause a temporary loss of consciousness. 1. Fatigue and drowsiness. Fatigue and drowsiness are some of the common symptoms of dehydration. They occur because water is essential for delivering nutrients and oxygen to our cells and removing waste products from our body. When you are dehydrated, our blood volume decreases, and our heart has to work harder to pump blood. This can make you feel tired and sleepy. Here is a detailed explanation of how dehydration causes fatigue and drowsiness. Our cells need water to produce energy. Water is involved in many biochemical reactions. Our cells cells need water to produce energy. Water is involved in many biochemical reactions, such as glycolysis, which breaks down glucose into ATP, the main energy source for our cells. When you are dehydrated, our cells have less water to perform these reactions, and our energy production decreases. Our blood carries oxygen and nutrients to our cells and removes carbon dioxide and other waste products from our cells. Water is the main component of our blood, making up about 55% of its volume. When you are dehydrated, our blood volume decreases, and our blood becomes thicker and more viscous. This reduces the blood flow to our organs and tissues and lowers the oxygen and nutrient delivery to our cells. It also increases the accumulation of waste products in our cells, which can interfere with their function. Our heart is a muscular organ that pumps blood throughout our body. It needs water to maintain its shape, contractility, and electrical activity. When you are dehydrated, our heart has to pump harder and faster to compensate for the reduced blood volume and pressure. This puts more strain on our heart and increases our heart rate and blood pressure. Our brain is the control center of our body. It needs water to maintain its structure, function, and communication. Water makes up about 75% of our brain mass and helps regulate the fluid balance in our brain. When you are dehydrated, our brain tissue shrinks and our blood vessels constrict. This reduces the blood flow and oxygen delivery to our brain. It also affects the production and transmission of neurotransmitters, such as dopamine and serotonin, which are involved in our mood, motivation, and alertness. All these factors contribute to the feeling of fatigue and drowsiness when you are dehydrated. You may experience symptoms such as weakness, lethargy, lack of concentration, irritability, and sleepiness. These symptoms can impair our physical and mental performance and affect our quality of life. To prevent dehydration, you should drink enough fluids throughout the day, especially when you are thirsty, active, or in hot weather. You can also eat water-rich foods, such as fruits, vegetables, soups, and yogurt. The amount of water you need depends on our age, weight, health, and activity level, but a general guideline is to drink 30 to 50 ounces, about 1 to 1.5 liters of water per day. However, you should talk to our doctor about the best fluid intake for you. Thank you for watching, and I hope you found this information on the consequences of dehydration valuable. Staying properly hydrated is essential for maintaining your health and well-being. To summarize, dehydration can lead to fatigue, drowsiness, dizziness, fainting, headaches, cognitive impairment, kidney damage, urinary tract infections, digestive problems, constipation, skin issues, and even premature aging. To prevent these negative effects, remember to drink enough fluids throughout the day, especially when you're thirsty, active, or in hot weather. Additionally, incorporating water-rich foods into your diet, such as fruits, vegetables, soups, and yogurt, can further support your hydration needs. If you have any questions or would like more information on this topic, please feel free to ask in the comments section below. Your health is important, and maintaining proper hydration is a simple yet crucial step towards overall well-being. Stay hydrated and take care of yourself. Don't forget to like and subscribe for more informative content. Thanks again for watching.